My name is Muneesh Tewari, and I'm at Fred Hutchinson Cancer Research Center. The Innovation Award is funding a research project in which we're testing a new idea. And the idea is that cancer cells release small packets of information that are in the form of a type of molecule known as RNA, and that these packets can circulate in the bloodstream. And the idea really is that we could potentially capture these packets of information and use them to detect cancer early at a stage where it's curable. One approach that we've taken is to try to think about, well, if there were a successful method, what would it look like? And we've identified a few different features of this. So number one would have to be relatively simple. It would have to be relatively inexpensive, at least eventually, and it would have to be very specific. So initially we thought that these packets were being emitted or released by cells in really little microbubbles, and it turns out that some of the information is actually coming out in microbubbles, but some of it is actually in fact coming out bound to a specific protein molecule. So what this really means is that there's actually two forms of this information, this RNA molecule that's coming out of the cells and getting into the bloodstream. And so now we're trying to take the next step, which is to try to develop methods to capture both of these two forms of information, because we think that's going to be important to have an effective test. Getting an award from Damon Runyon means a lot, and really probably for two reasons. I think the one reason is it's very prestigious. I mean, these awards are not easy to get, and the people who have gotten them in the past have really gone on to do really amazing things. And I think the other reason is that the outlook of the Damon Runyon Cancer Foundation, and I think of the scientific advisors that advise the foundation, is very broad. It gives you a lot of flexibility with respect to where to take your research project and to do really innovative things. I'm a physician scientist, so I see patients, and I think how that influences my research is that even though we do a lot of really laboratory research, it's always with the end in mind. It's always with the thought of how is this eventually going to impact patients. It's a really great feeling to be able to work on research in the laboratory that you can see could, at least in the midterm, really affect patients. And so the research that's funded by the Innovation Award is specifically to try to develop a diagnostic test that could detect cancer early when it's curable. And the real idea is to use some innovative approaches to try to do this and to try to solve this problem. And honestly, to be lucky enough to work on such an important problem and to be funded to do this is, it really makes it easy to get up in the morning and come to work.